Hi, and welcome to a video lecture about the different team members in the veterinary hospital. This presentation is called the RVT and the VOA, an essential veterinary team. So what we're going to talk about in this video lecture here is the different roles within the hospital. So we'll talk about the veterinarian, the RVTs, which are registered veterinary technologists or technicians, and the VOAs, or the veterinary office assistants, or in Calgary, you're called VOTAs, so veterinary office and technician assistants. We'll also talk about kennel attendants. So then we're going to kind of highlight the roles of the different people in the hospital, what they do all day long, in a little bit of a day in the life segment. So we'll learn what do the techs do, and sorry, I'm just going to pull this back a bit. I realized I was cutting off the top. And we'll talk about what do the VOAs or the VOTAs do to help. And then since this is a video lecture, at the end we're not going to do any questions, but you can certainly ask questions in the chat or in the virtual classroom as well. So first off, let's talk about the veterinary hospital roles. So who does what in the vet hospital? So first of all, we have our veterinarians. So veterinarians are responsible for meeting with clients. So typically it's the vet that the client is at the hospital to see. So the doctor or the veterinarian, they are the ones that are examining the pet. They are the ones that are ordering diagnostic tests to try to determine what's wrong with the animal. They're the ones that are interpreting the results of those tests, and they use that interpretation to make a diagnosis. So a diagnosis is determining what exactly is causing the pet to feel sick. So it is basically naming the disease, and then next they create a treatment plan. So the treatment plan could involve things like prescription drugs, could involve treatments such as like a nail trim or hydrotherapy or bandages. They're also responsible for performing surgery as well, which can be part of a treatment plan. So to become a veterinarian, the doctor has to have a DVM degree, which is a Doctor of Veterinary Medicine. In Canada, there are quite a few universities that do offer a Doctor of Veterinary Medicine degree program. This presentation was made for Manitoba students, so I have here that they are registered with the MVMA, which is the Manitoba Veterinary Medical Association, or in Alberta, they will be registered with the ABVMA, which is the Alberta Veterinary Medical Association. It is possible for internationally trained veterinarians to work in Canada as well. And typically what they need to do to get a license to practice in Canada is complete a series of tests, basically to prove that their degree or their knowledge that was obtained outside of Canada is up to this Canadian standards. And then once they've achieved that, they would be able to register with their provincial association and then practice veterinary medicine. Next we have our registered veterinary technologists, also called registered veterinary technicians. So the term technologist and technician is fairly interchangeable in Canada. In the United States, there is a difference between technicians and technologists, but we don't recognize a difference here in Canada. So what are techs doing in the hospital? The techs are responsible basically for executing the treatment plans that the doctors come up with. So if the doctor orders a diagnostic test, the technologists are the ones that are collecting samples to run that test. We're also the one that are performing lab work, we're taking x-rays, we're carrying out the treatment plans, we're preparing patients for surgery, performing and monitoring anesthesia, and then we also get to do the really fun stuff like dental cleanings and dental x-rays too, which is one of my favorite things to do in the vet clinic. So how does one become a registered veterinary technologist? You need to have a veterinary technology diploma. One thing I just wanted to add is like veterinary technologist is a fairly new distinction. I'm gonna say like in the, I don't know, maybe last 10 years or so that's been the proper term for veterinary technologist. Prior to that, it was animal health technologist. So you might still see RAHT sometimes, like an older print material. RAHT is registered animal health technologist. So they'll have a VT diploma, so a vet tech diploma, or an animal health technology diploma. And then in Manitoba here, we have two associations that registered vet techs are registered with. One is the MVMA, the Manitoba Veterinary Medical Association. The other is in the MVTA, which is the Manitoba Veterinary Technology Association. I'll be honest, I did not look into what, you would have to be registered, I would think, with the ABVMA. I honestly didn't look into it though, sorry, for Alberta technologists, but they would need to be registered with some association in order to practice vet medicine. And then we have our veterinary office assistants or veterinary office and technology assistants. So if you are working more in the front end, you're going to be responsible for doing a lot of reception duties. So that includes things like answering the phones and scheduling appointments, taking care of paperwork, and then filing and completing files if you have paper files like this hospital has back here. The VOAs up front are also responsible for billing clients and collecting those payments. They're responsible for cleaning and stocking supplies and acting as an assistant for the vet techs and the doctors. So that usually involves lots of restraint or preparing for procedures by like setting up supplies and equipment. So veterinary office assistants have a VOA or a VODA diploma, like the one you're pursuing here with Robertson College, which is awesome. VOAs and VODAs do not need to be registered with any of the associations. I would love to see that change though, honestly. I think properly trained VOAs and VODAs from like a college program such as this are such an asset to the clinic, and I would love to see you guys get more of the recognition you deserve. And part of that is having like some kind of association so you can kind of collectively advocate for the profession, right? Okay. And then we have kennel attendants. So kennel attendants are responsible usually for things like cleaning kennels, doing hospital cleaning, doing laundry, and depending on the kennel attendant, I may have them help with feeding or walking pets or helping with restraint. But honestly, I prefer to leave that for my VOAs or my VODAs because you guys have the proper training to do that. So typically kennel attendants are trained in-house. And then obviously they don't need any kind of registration. In my experience, kennel attendants in the hospital are often students that are pursuing either veterinary technology or veterinary medicine as a career. Like doctor of veterinary medicine as a career. So they're often just wanting to like volunteer and just be around the hospital to try to absorb as much as they can. So I usually like to have my VOAs be my restrainers, or I'll get my VOAs to help with feeding and walking pets over the kennel attendants. But there are sometimes kennel attendants that are very keen and pick up things really quickly, and in that case, sometimes I will have them help me with that. So there are other positions in the vet hospital. I just kind of limited it to those 4 for this presentation. But that being said, like often vet clinics will have groomers that work out of the vet hospital. There may be other kind of like layers of people that are helping with like cleaning and kennel attendants and then VOAs. So it just kind of depends on how the hospital is set up. And then often there's management positions in the hospital as well. So there might be like a hospital manager or an office manager. Typically that will be a VOA or a technologist that is taking on some of the more administrative roles in the hospital. So moving forward then, let's look at a day in the life at a vet hospital. So I have a little math equation here. RVT plus VOA equals success. And it's so true. In the veterinary hospital, good teamwork is so key to getting anything done well and in a timely manner. So ideally, my best case scenario is having amazing VOAs that really know their stuff and can work well in conjunction with me to be able to get as much done during the day and to take care of as many pets as we can. So as a little preface, I based this day in the life on, it's kind of like an amalgamation of many of the clinics that I have worked in or done practicums in. It might not be accurate in every single hospital because different places will do things different ways. Like I did do a practicum at one hospital that did surgery just like all day long. So it kind of just depends where you work and how things are set up there. I wrote this presentation based on like hospitals having paper files. So things might look a little bit different if you do have computerized files in the hospital. So typically throughout the entire day, VOAs are responsible for working at the front desk. They'll be answering phones. They'll be scheduling appointments for those phone calls. They'll be prepping files for the appointments, again, assuming that there's paper files. So to prep files, we're date stamping. We're making sure that there's enough pages for the doctor to write in, like enough room. We might be having, including little maybe questionnaires for the client to answer. Things like that will be included in the file. And then after appointments are done, the VOAs are responsible for reviewing the files to make sure that there were mischarges, to make sure that if there are any recall, check-in calls, that those are set up with reminders in the computer, making sure that there's vaccine reminders entered, that kind of thing. And then VOAs, I like it personally when VOAs are responsible for performing those care calls. So care calls are like the recall that we'll do after a pet's been in the hospital. So if a pet's been sick, we want to call and check in, see if the treatment is helping. If a pet has changed food, we want to call and check in, see how the animal's liking the new food. If an animal's had surgery, we want to check in after surgery to see how they are. We might be doing care calls to remind them to schedule certain types of appointment, like blood work or prescription refills, etc. So I think that's like an excellent task for a VOA to do. But that being said, I have worked at hospitals where the techs do them. I've also worked at hospitals where the doctors do them. So personally, I think it's a good task for the VOAs. And then if they need to defer to the doctor on a question or something, they certainly can do so. But otherwise, I feel like, I don't know, I just feel like you guys are well suited to that task because usually the clients know you, right? Because you're the first and last person that they see in the hospital. So they have a bit more of a relationship with the VOAs, I find. And then lastly, VOAs are selling food, over-the-counter products, and prescription refills that come in throughout the day. So these tasks alone are plenty to keep a VOA busy throughout the day. Same with the technologists. Our kind of entire day looks like seeing tech appointments, doing nail trims, anal sac expressions, routine blood work, laser therapy, performing diagnostics and treatments for appointments. So if an appointment is in and they need a nail trim or they need an x-ray or blood work, we're taking care of those things. We're also responsible for doing lots of client education. And honestly, that should be included on the VOA side as well. Usually formal education appointments are made with technologists, things like the diabetic consults or treatment demos, things like performing subcutaneous fluids or like blood glucose curves. Usually the tech's going to teach them how to do those things. And then same with puppy and kitten visits. Those are things where we'll talk to them about training and cutting their nails and brushing their teeth and grooming, that kind of thing, like just general how to take care of a puppy and kitten visits. But VOAs do a lot of client education as well. Again, because you're often doing like discharge of clients and talking to them after the appointments, making sure they know how to give medications, that kind of thing. And then techs are also performing nursing duties for any hospitalized patients. So if there are patients in that are sick and need force feeding or medications or IV fluids, we're the people that are responsible for doing that. I haven't really been explaining my pictures here very well, I don't think. Oh, whoops, I'm skipping ahead. This is just a picture of like a waiting area. So I use that because that's like kind of the front desk idea, right? And then this is a treatment area with kennels for observation as well. Okay, so prior to the hospital opening to the public, if there's animals that are in the hospital overnight, we need to take care of those guys before we can open up the hospital. So typically we're going to do some teamwork, right? Vet tech and VOA are going to work together. We're going to walk any dogs that were spending the night at the hospital. And we are going to change bedding, set up a fresh kennel for them so that they have nice, a nice fresh place to lay down, not one that's like urine soaked or something. If it's cats overnight, we're changing litter boxes, giving them fresh boxes. And we need to feed and water all the overnight pets. If there are medications to give to the animals or any kind of exam that needs to be done, the vet tech is going to be responsible for doing that. But if it's like oral medications or an exam, I may need help from a VOA as well. So once the hospital is open, typically the first hour or so is going to be spent doing admissions for surgery. So in my experience, the doctors don't tend to show up for at least an hour after the hospital has opened because they just we don't do appointments that first hour because we're so busy with this admissions process. So side by side, VOAs and vet techs are doing different tasks at this time. So the VOA is going to be doing things like greeting the clients as they come in. They're going to be confirming procedures and the locations of procedures. So let's say we're doing a knee surgery. Which knee is it? We're removing a growth. Where is the growth? We need to confirm those things. The VOA is going to go over a consent and admission form and have the client sign it. The VOA will weigh the pet and then put the pet into a kennel. They're going to label the kennel. So we have like kennel cards to place in there that identifies the animal. And we're going to label any belongings that the animal came with. So carriers for cats, leashes for dogs. Sometimes people will bring toys or blankets. I like to label those and put them somewhere safe because we do not want to lose any of the patient's belongings while they're in the hospital. I also don't consider it very safe to keep their belongings with them. So if we, clip a leash to the kennel, it's possible for the dog to grab that leash and destroy it, which could be a possible foreign body issue. And certainly is an issue with, hi client, I'm really sorry, but your dog destroyed your leash today. So I like to put those things somewhere safe while they're in the hospital. Then the pet needs to be recorded on the whiteboard. I'm just going to flip back to our treatment area picture here. In this picture, this is the whiteboard right here. So this little guy is where all the patients in the hospital are going to be written down. And we put in there what tasks need to be done for each patient. So they need a medication at 4 p.m. We record that. And then when that medication is given, we can check that off. So the pet needs to be recorded on the whiteboard with any procedures that's going to be happening written on there as well with them. And then if there are any blood work to be done prior to surgery, the VOAs are going to assist the technologists with that. So while the VOAs are busy up front with the clients and the patients, the vet techs are busy in the surgery and treatment area, getting everything all set up for surgery. So we're going to set up the surgery room for the specific surgery that's happening. So we're going to pull out surgery packs. We're going to set table heights. We're going to set up all our monitoring and anesthetic equipment. If there's dental procedures going on, we'll set up the dental area, prep the dental machine, prep the dental x-ray, just set up the area in general with equipment and supplies. Any anesthetic that is happening that day, the anesthetic machines must be leak tested. We're going to prep our patient files by writing in there what all is happening with the patients that day. We'll write our exam results. We'll write what drugs are going to be used. Then we're going to calculate drug doses and drop the drugs in labeled syringes. So most of the hospitals I've worked at, the doctors have kind of a pretty established protocol that they like to use for certain types of patients. So I kind of work off the assumption that they're going to use those same protocols. I do always, though, confirm the drugs of choice with the doctor prior to actually using them. And then we will obtain samples for blood work and then process that lab work if it's happening. So then after that first hour, it's been really busy. We've been intaking all these patients. We have them set up in their kennels. Doctor arrives after the first hour. So at that time, the doctor and the RVTs are going to have a little bit of a meeting, and we're going to figure out the order of the surgeries. Typically, I have an idea in my head of how things are going to go. Usually I'm pretty right in guessing what order the doctor would like to do things, but I always like to confirm before I go ahead with anything, just in case they have a different idea in mind. Obviously, I'm going to need to defer to the doctor because they're kind of like, they're the head honcho. Technologists and VOAs can't really do anything in the hospital without the supervision of the veterinarian. So we need to make sure that anything that we're giving or tests that we're doing have been ordered by the doctor. So after we determine the order of the surgeries, the doctor's going to check the blood work, make sure that everything is okay on there, and if it is, they'll approve the pet for surgery. If there are problems on the blood work, the doctor is going to likely call the client and discuss what they see, and then make a plan with the client if we go ahead with surgery with modified protocols or if we postpone surgery for another time. It's going to depend on what's going on with the animal. Then the doctor is going to confirm the drugs used to premedicate and induce anesthesia, and then the doctor is going to start some morning appointments. So while they're seeing appointments, the technologists are going to be doing any treatments that come back from the appointments, but we're also going to continue to prep for surgery. So about 20 to 30 minutes before the surgery time begins, we're going to need to make sure that our patients are pre-medicated. So in order to do that, I like to recruit a VOA or a VOTA to come and assist me by restraining my patient. Then I'm going to perform a pre-anesthetic exam, which includes taking a temperature, a pulse rate, and a respiration rate. And then when that all looks fine, I'm going to go ahead and give a pre-medication injection. So often we'll give a pain relief injection of an NSAID, which is a non-steroidal anti-inflammatory drug. And different clinics, different doctors are going to use different pre-medications. The last place I worked at used a cocktail called BAA. It consists of butorphanol, which is a opioid, atropine, which helps to keep the heart rate up, and acepromazine, which is a sedative. So some hospitals will use different drugs. This is just an example of one pre-medication cocktail. And then surgery time happens, and we are going to need to be excellent teams, the RVTs and VOAs, because we're going to work together to get the animal into surgery. So first step, the VOA is going to restrain the patient while the technologist is placing an IV catheter, administering the IV induction drugs. So one example is ketamine and Valium. Another example is propofol. And then we're going to intubate the animal, which is putting an endotracheal tube into the trachea so that we can administer oxygen and anesthetic gas. And then we'll set the patient up on the anesthetic machine. So this here is the anesthetic machine. The RVT is then going to prep the surgical site while the VOA is still restraining. We're going to shave the area, we're going to vacuum up the hair, and we're going to express the bladder. If it's like an abdominal surgery. If it's like an eye surgery, we're not going to express the bladder. And so all these things typically I need the VOA's help with, because once the animal's under anesthetic, they're really floppy, so I need you to help hold them in place. And then I definitely need help with expressing the bladder, because I need 2 hands to be able to do that, and I need a VOA to hold the bowl for me. And then the 2 of us will move the patient into the surgery room together. So especially if they have IV fluids, it's good to have 2 people. If it's a large animal especially, you definitely need 2 people. Then the VOA is going to hold the patient stable while the vet tech ties the animal into position. So again, because they're all floppy and under anesthetic, they're not just going to lay nicely on their backs. We need to tie their arms and legs to the table so that they stay in the correct position for surgery. And then I have here that the vet tech places monitoring equipment, but honestly, the VOA can help with that as well. So typically we'll place things like a pulse oximeter, which is like a little clip. You clip it to the tongue and it tells you how much oxygen is in the blood, and it tells you what the heart rate is. We might be placing blood pressure cuffs, a thermometer, or ECG leads. So VOAs and vet techs can both do those things. And then the RVT is going to scrub the surgical site, have it nicely prepared for surgery, and then I'm going to remain in the room and continue to monitor that anesthetic. So at that point, usually once the surgical scrub is done, the VOA is going to step out of the surgery room, because we like to have as few people in the surgery room as possible. So just the bare minimum to, usually like the surgeon and the anesthesiologist, which would be the vet tech. So after the VOA leaves the surgery room, it's a great idea to go and prep the kennel for that surgical patient. So you can do that by making sure that the bedding is fresh, that they didn't pee their bedding before they came out for surgery. Sometimes the pre-anesthetic drug causes them to vomit. So we want to clean any of that up and give them nice fresh bedding. If it's a patient, like a really old patient, or a patient that's having like bone surgery, I like to make them a really nice, cushy, cozy bed so that they don't have any pressure sores or anything from, laying on the hard stainless steel of a kennel. And then also we want to have heating pads prepared in the kennel for the animal. Animals that are having surgery lose body heat really quickly, and anesthesia removes the ability to maintain body temperature very well. Did I say lose body weight quickly? I meant lose body temperature quickly. So we want to help support their body temperatures by giving them heating pads to keep them warm. Then the vet tech is going to recover the patient from anesthetic and extubate them or remove that tube from their throat. And then if it's a small animal, I'll probably just carry them to their kennel myself. But if it's like a big dog, I'm going to need help moving them. So I'm going to, again, recruit my VOA to come and be my assistant for that. So once all the surgery patients are finished their procedures, the doctor's responsible for writing in the surgery files. They need to write what the procedure was that they did, any discharge instructions, etc. needs to be written into the files by the doctor. Then the vet techs can take those files and complete them. So we make sure that everything has been documented that happened during the day. We make sure our anesthetic records are included in there that we use during surgery. And then we're going to write up discharge instructions to send home with the owners. We always want to go over discharge instructions verbally with the owners, but we want to send home written instructions as well so that they have like a reference material once they go home. The vet techs are going to enter the charges for the bill as well and then fill prescriptions. Now, sometimes it's an insane day and it's hard for the vet techs to get to all this. We might have surgery patients all morning and lots of nursing patients that are hospitalized as well. So sometimes it can be tricky to get to these tasks after surgery. So if the techs are really swamped, and the VOAs are maybe having a bit of an easier day, it's really helpful for the techs if the VOAs do some of these things like enter the charges or fill the prescriptions, because those are things that the VOAs are very capable of doing. So then typically after surgery, there's a bit of a break for lunch. And then once the doctor returns, afternoon appointments begin. So during that time, the VOA is going to be greeting the clients, weighing the patients, and bringing them into the exam room. Sometimes VOAs will have a little bit of a chat with the clients, get a very brief history that they can share with the doctor. Sometimes they'll be discussing client education items like vaccines that might be due, or if the animal has gained a lot of weight, they might be talking about weight loss or nutrition. Some hospitals do have the vet techs start the appointments. So they'll have the vet techs go in after the VOA, again, take a history, do a TPR, that temperature, pulse, and respiration, and then report back to the doctor, who goes in and takes a history, listens to the heart, and does a thorough exam. I personally don't love that format. I feel like it's, I don't know, I feel like clients want to see the doctor, and I feel like it doesn't make sense for a tech to take the history and then the doctor to do it as well. But different hospitals are going to run different ways, so it just depends on what the protocols are in the hospital. So once it's time for the doctor to enter the room, they're going to examine the pet, and then based on what the findings are, they may order treatments or diagnostics. And then if they do order any treatments or diagnostics, it's going to be the vet techs that are responsible for doing those. So here's just a bit of a list of things that might possibly be ordered during an appointment. So we may be asked to take x-rays of an animal. We may be asked to collect blood and run some blood work, or collect urine and run a urinalysis. We might be asked to do a fine needle aspirate, which is taking a needle and poking it into a lump to see what kind of cells are in the lump. So we can test to see if something is cancerous or if it's maybe just a fatty lump. We might be asked to perform tonometry, which is testing the pressure of the eye. We might be asked to do nail trims or anal sac expressions, ear cleaning if they have ear infections, bandaging if they have a wound or a broken limb. We might be asked to give subcutaneous fluids, which is like the IV fluids that we would use, but putting them under the skin instead of into the veins. And we might be asked to give injections of various drugs. If we need to do any of these things, animals don't sit still to take x-rays. They're not going to sit still while you touch their eyes or touch their butts for an anal sac expression. So I need a restrainer. And I like my VOAs to be my restrainers because they are well trained in this realm, right? If I can stress anything to you, it's make sure that you've got a really good handle on restraint. A VOA with excellent restraint skills is such an asset to a clinic. Anything you're doing, you need to restrain the animals. They just don't cooperate. They don't want to sit still while you do any of these things. So we need someone that's trained and able to hold them properly for those different procedures. So after we've completed the treatments, the VOAs are going to enter the charges for the bill. So you're going to need to read through the file, make sure everything that was done has been charged for. Sometimes some clinics will use what's called a travel sheet, which has a list of all the possible things that could have happened while the animal is in the hospital, and the doctor will check mark off all the things that they did. That makes it fairly easy to enter the bill. VOAs will fill any prescriptions that are going home. And then once they're done getting those things ready, they're going to head up front with the client, and they're going to discuss things like nutrition with them. They'll discuss the bill with the client, go over it, make sure they understand everything that happened. If there's prescriptions going home, the VOA is going to go over the prescription instructions and may be instructing them on how to give the medication as well. So you might be demoing like giving a pill or giving a liquid medication. VOAs will then collect payment, And if necessary, if the animal has pet insurance and the owner needs you to like fax in the forms, you might be responsible for submitting pet insurance forms. Honestly though, I think a lot of the pet insurance companies now have like apps for submission where they just have to take a picture of the bill and send it in. So that, depending on what format of pet insurance they have, this might not really come up for you. And the VOAs are the timekeepers for the day. So I think having great time management skills is a really good, soft skill for a VOA. And being great at kind of directing others is another really good skill. So doctors are notorious for just chatting away, taking their time, taking a really long history, doing the world's most thorough physical exam. Like, they're just slow moving sometimes. And they're easily distractible, it seems like. So it's important for the VOAs to, say, oh, hey, don't forget, you have an appointment waiting in room 2. Things like that. Make sure things are on the go. VOAs are the people that have the best idea about what's going on in the hospital, because you know every single person that's walked in that door. You know what their status is. Have they been seen by the doctor? Are they waiting on treatments from the techs? Are they just waiting on their bill now? So you are the people that are responsible for kind of overseeing the arc of their appointment. So sometimes what happens is vet techs end up with lots of things lined up waiting. And then the VOAs can say, oh, hey, don't forget, you've still got Jonesy up front. And then, we can make sure we're taking care of everything there. So VOAs are the timekeepers for the hospital. I always like to I'm just going to go back one there. I always like to kind of compare like the vet clinic to like the theater. So this kind of maybe just a little analogy for you to kind of picture it. But I always say the doctor is kind of like the lead actor or actress. They are the person that everyone's come to see, right? They are the one that like kind of like the rock star that everyone's there to meet this doctor. The technologists are kind of like the backstage people that make sure the show happens. So we're opening up the curtains, we're making sure all the props are in the proper place, we're sending people out when they need to be, etc. And then I say that the VOAs, they're the directors. They're the ones that are saying, hey, look, it's great that you're a doctor and amazing. I need you to actually do your job. You need to be in this room now. So the VOAs are the people that kind of almost are like the boss, right? They're the director and making sure that everything goes well and all the patients are seen in a timely manner. So as we get towards the end of the day, it's going to be time for our surgery patients to go home. So we have, again, different hospitals are going to do things different ways, but I like when VOAs are able to do discharges for like at least our simple surgeries. So if we have surgeries like spays and neuters that are very routine, I do not think it's unreasonable for the VOAs to go over those instructions with clients. So what you're going to do is review the discharge instructions verbally, and you'll send them home with the instructions on paper. You'll also review any prescriptions going home with the client and making sure that they know how to give those prescriptions. And then you'll also collect the payment for the surgery that day. While you are doing that, the vet techs are going to be cleaning up the pet, making sure that everything's all ready for them to go home, and then gathering up their belongings as well. And then end of the day arrives. All of the hospitalized surgery patients have gone home. Now it's the end of the day. We're finishing up appointments. What do we do to finish out our day? We need to clean the entire hospital. So hospitals need to be of the utmost cleanliness so that it is, not spreading diseases around by having dirt everywhere. So the vet techs and the VOAs are going to work together to clean the entire hospital. If you have kennel attendants and they're going to do cleaning, even better, because, many hands make light work, right? So the more people doing the cleaning, the better. In my experience, vets don't clean. They see their appointments and they leave at the end of the day. Maybe you'll experience something different, and that would be awesome. But in my experience, I've never ever seen a vet clean. And then the VOAs are going to restock vaccinations and supplies in the exam rooms. So anything that was used needs to be replaced. And then typically the VOAs are going to close out cash and lock up the hospital. If there are any hospitalized patients, the vet techs are going to take care of them before we leave for the day. And the VOAs are usually the last person to leave the hospital, so they can just check in on any hospitalized patients to make sure they're okay before they leave. And if they weren't okay, they can call the doctor or the tech to check in on what they should do. So that basically is a walkthrough of a day in the life in the vet hospital. So again, like I said, that's based on like, in Winnipeg here, we have like fairly like lots of little vet clinics. So where there's like, 2 or 3 doctors working, and that's kind of like the flow to the day that seems to work for that size of animal hospital. If you end up working for a much larger hospital, they're going to have things set up different ways. Or if you're working for like an emergency hospital and you're doing things overnight, obviously your day is going to look a lot different than that morning, afternoon, evening kind of lineup. So different places will do things differently, and that's okay. So your job is to figure out what your job is in the hospital, and then to just thrive and do a really great job at that. So I love working with VOAs and VODAs. While it is technically possible for veterinarians to hire anybody off the street to serve as a receptionist, I personally would way rather have someone that has actually been trained and been through a program like we offer here at Robertson. You have such a better amount of knowledge coming into that job. You know what you're getting into. You have some experience handling animals, doing that restraint. You know a lot of the protocols. Why on earth would I want to hire someone off the street? It's just not worth it to me to have those kind of people in. So ideally, like I said, I love to work with VOAs. So hopefully this kind of overview of the different positions in the hospital has given you an idea about how hospitals run. If you do find that you have any questions at all, please do make a note of them. Ask them in the chat, ask them in the virtual classroom, or even just send me an email. Any of those things are acceptable ways to reach me and ask those questions. Ultimately, you are entitled to a complete understanding of everything we cover. So if you do have questions, please do reach out. Okay, thank you for listening to this video lecture about the tasks in the vet hospital and the different roles. Thank you.